Good Friday morning, Northern Michigan. Going into the new year, there are some changes that are happening with the healthcare industry and also a new state bill that's going into effect January 1st, and it involves your insurance. And that's why we brought senior benefits consultant John Closz with the Larkin Group into the studio today. Good morning, John.
Good morning. It's a pleasure to be here.
Thank you for being here. Looking at these changes that are happening in the healthcare industry, what do people need to know going into the new year?
Well, there's a lot of changes that are going on, and some of those I kind of highlight as far as different product designs. Certainly funding arrangements are different, a little different now. A greater emphasis on prevention than there's ever been before. And wellness programs. I think employers are beginning to offer more of the wellness programs. But these are really all done to help reduce risk and contain cost.
Okay.
Yeah, and the real challenge here is the cost. Over the last few years here in Northern Michigan, I've seen premium increases from employers that have ranged double-digit year to year, and some of those increases over 25%. Consequently, what happens is the employers pass that cost on to the employee in the form of reduced benefit designs or increased employee payroll contributions.
Okay. And also kind of going back to the new Michigan tax bill that'll be signed into law, or that is signed into law, it'll take effect January 1st.
Yes.
How could this have an impact on an employer?
Well, let me tell you a little bit about the law. It's called the Health Insurance Claims Assessment Act, or better known as the Michigan 1% Claims Tax. And you're correct. It was signed into law last September by Governor Snyder, and it will be effective January 1, so that's right around the corner. The purpose of this law is to raise $400 million for the state's Medicaid program. How that will be done is that the carriers will pay the state of Michigan 1% of their annual claims costs. It's going to affect a lot of us out there. Any of us that have group coverage, commercial group coverage, people that have fully insured plans or self-funded plans, individual coverage, and Medicaid plans. And subsequently, what's going to happen is they're going to collect that money as a percent of the insured's monthly premium.
Okay.
Right now, because it's right around the corner, January 1, employers are beginning to see those invoices, and on the invoices is a separate line item, so they'll be able to determine that.
And quickly, John, how can people learn about these changes, get a little bit more information about them?
Well, one of the things that I would certainly recommend is to call the Larkin Group. Education is huge in this industry. With all the changes going on right now, people need to really have a better understanding of what's going on in the healthcare industry. I personally feel that education means people make more or better informed decisions. So we recommend that you give us a call. One of the initiatives we have going right now for our clients is we offer a quarterly newsletter, and it addresses these types of issues. Again, education is very important. So please give us a call.
Thank you very much, John Closz with the Larkin Group. We appreciate you being here this morning. Very helpful information going into the new year. For more information about the Larkin Group in Traverse City or any of the information that John Closz covered, go to our website. You see the link right there, upnorthlive.com.